Hey everyone, I apologize in advance for my voice. I have laryngitis, so I'm going to get through this as best as I can. How many of you get the right amount of sleep every night and feel refreshed each morning? Do you get 7 to 9 hours? Most college students are lucky if they get 5. According to the National Sleep Foundation, most Americans are not getting enough sleep at night. In fact, 39% of Americans are not getting the 7 to 9 hours recommended, and 74% experience sleep problems that affect the quality of their sleep. Whether you are in college, are middle-aged, or over 7 years old, this speech applies to you. Although sleep needs change over the course of our life, sleep will always be crucial. Before preparing my speech, I interviewed my mom. She's a respiratory therapist and works at Precision Diagnostic Services and is their regional manager. PDS is a company that tests, diagnoses, and treats people with chronic sleep disorders. She has been a respiratory therapist for 24 years and provided me with very valuable information. The amount of sleep we get each night has direct effects on our bodies, both physically and mentally. Today I'm going to speak to you about the importance of getting sleep, give you some tips for getting better sleep, and talk briefly about sleep disorders. During my interview with my mother, she emphasized that the importance of getting good sleep is that it is key to our health, performance, safety, and quality of life. It is just as important as good nutrition and exercise to our health. In fact, it is as necessary as the water we drink, the air we breathe, and the food we eat to function and live our best. Now that you know why it is important to get good sleep, I'm going to give you a few tips for better sleep. According to Mayo Clinic's article, Sleep Tips, 7 Tips for Better Sleep, there are 7 ways you can get better sleep at night. First, stick to a sleep schedule. Go to bed and wake up roughly at the same time every day. Having a schedule reinforces your body's sleep-wake cycle and helps you sleep better at night. Second, pay attention to what you eat and drink. Do not go to bed too hungry or too full. And also limit how much you drink before bed to avoid unnecessary trips to the bathroom. Lastly, limit alcohol, caffeine, and nicotine use, as these can all disrupt your sleep. Next, create a bedtime ritual. Do the same things each night if possible to tell your body that you're getting ready for bed. Examples would be taking a shower, reading a book, or even listening to music. However, don't watch TV or use electronic devices, as these can interfere with your sleep. Next, get comfortable. Buy a few comfy pillows and maybe a mattress pad or a new mattress if possible. Create a room also that is ideal for sleeping. An example would be a cool, dark room. Next, limit daytime naps. If you're going to take a nap, make sure that it's between 10 and 30 minutes max. And if you work a nighttime shift, make sure that the room is dark so that your body isn't confused and your internal clock doesn't adjust. Next, include physical activity in your daily routine. Physical activity has been proven to promote better sleep. It helps you fall asleep faster and even enjoy deeper sleep. Don't exercise too close to bedtime though, because you may be too energized to fall asleep. And lastly, manage stress. When you have too much to think about, you will not get quality sleep. Try organize, set priorities, and delegate tasks in order to decrease and manage your stress. Try this. Before bed, write something down that you're thinking about and set it aside until the morning. This way you won't think about it while you're sitting waiting to fall asleep. Part of the reason why we don't get adequate sleep could have to do with a sleep disorder. I will briefly tell you about 2 of the most common sleep disorders in America. First, insomnia. In Sleep Passport's article on insomnia, it was stated that estimates are that more than 30% of Americans have insomnia. That means that upwards of 100 million people in the U.S. may not be sleeping well, which is a staggering number. And 30 to 50% of people around the globe have some difficulty with sleeping. Insomnia includes inadequate or poor quality sleep. They also have difficulty falling asleep, could possibly awake frequently during the night. They also wake up too early and then they can't get back to sleep. And this sleep is unrefreshed or non-restorative sleep, which is not good. Next, we have obstructive sleep apnea. Now, 1 in 4 men and 1 in 7 women have sleep apnea, according to the 2009 Sleep in America poll. Sleep apnea is characterized by pauses or gaps in breathing due to an obstruction of the airway. It increases as we age. As you can see, 4% and 2% of middle-aged men and women have it, and close to 27% and 19% of older men and women have it when they're older. According to WebMD, the risk factors for sleep apnea are being male, being overweight, over the age of 40, having a large neck circumference, family history, and previous sinus problems. Obstructive sleep apnea can cause increased sympathetic nerve activity, increased arousals and sleep disturbance, increased cardiovascular events/death, increased risk of hypertension, stroke, and lastly, increased risk of death. Now, a CPAP mask is used to treat sleep apnea. That's just one of the treatments. I have one with me today. It goes over your mouth and your nose and helps you sleep better by providing continuous positive airway pressure. Now, let's recap what we talked about today. As you have seen, the amount of sleep that we get at night has direct effects on our bodies. Today we learned about the importance of getting good sleep. I gave you some tips to get good sleep and briefly talked about sleep disorders. Now that you're probably all asleep already, make sure it's not a nap longer than 30 minutes. Thanks for listening to my speech.